Welcome to Two Pete's in a Podcast, where we will talk about child health from birth right away through to adolescence, dealing with issues of illness, development, and everything else that is of importance.
Hello everyone and welcome to episode 17, Two Pete's in a Podcast. Thanks for tuning in. I'm Michael Platten and with me I have Simon Strawn.
Hi everybody, welcome back.
That dude, right. Today we are finally talking about diarrhea.
Wonderful. Diarrhea.
The brown rain.
Yeah.
It's taken us a while to get here. We really did want to do this before gastro season. What we're going to be talking about in this podcast is just an overview of diarrhea, like what's normal, what's abnormal. With the next podcast, we're going to be talking about why, and then into treatment, and then finally the warning signs. What is normal for stooling? That depends on your age and what type of milk or food you are getting. Normal stools for a breastfed baby is 1 stool in 7 days, 1 on Sunday, 1 the following Sunday, or 7 in 1 day. So 7 on Monday, 7 on Tuesday, 7 on Wednesday, new packet nappies, 7 on Thursday, we carry on like that. The older you get, the frequency reduces, and we're aiming for normally 1 to 2 stools per day. You can possibly push, I'm not sure if you agree with this, you can possibly push 48 hours, like in a child less than 1 year, as long as it's soft when it comes out.
Yeah, I'm happy with that. I think that also, I just get worried that very often when children are going and only going once every 48 hours, that they're doing that and they're sitting down if they're old enough and not quite evacuating completely. And then they do end up with constipation. So I just think generally speaking, if you're eating the right diet, and which means the right amounts of fruits and vegetables, you should be pooping every day.
And water. You need something to lubricate everything to
you should be pooping every day.
Yeah.
And I say your poop should be soft like toothpaste. So if it's on either side of that, you're kind of looking at it going, what's going on here? But diarrhea, what are we talking about? We're talking about diarrhea. So diarrhea means watery stool. So if we're in the situation now where we're going to say your child has got diarrhea, we're going to say you're having 3 or more watery stools every day. Unless, Mike, as you're saying, it's the tiny baby who's being breastfed. And we know breastfed babies, their poop looks like really runny scrambled egg.
Yeah. It can be very watery. It can be watery with seeds in.
Exactly.
It can go into mustard, peanut butter, not plain, not bottrolls, not little hard pellets.
Yeah, not hard pellets.
Yeah. So 3 or more stools per day that are very watery. And we expect that to get better over time. And you're looking at a duration of about 5, maximum 7 days.
If we talk about gastroenteritis as the cause.
A viral gastroenteritis.
Yeah, as the cause. Yeah. So I think let's rather just say diarrhea. So diarrhea means watery stool. So if you go and have something that you've eaten that's a bit off, or you go and stuff yourself full of apricots or something, you're going to get a runny tummy. Doesn't mean you've got a gastro or an infection, but you've got a runny tummy. Children who are breastfed or drinking a lot of lactose in milk, which they do in all the formulas, that's why they have loose stools, because there's lactose in it. If you yourself have a little bit of lactose intolerance, you know that when you drink or eat dairy, that your tummy becomes a bit funny. So if we look at why you get it, we're saying there may be things about you as an individual where you may be sensitive to certain things. You may have an infection, which we would call gastroenteritis, which can be a virus, or it can be bacteria, or it can be parasite sometimes. Sometimes you have diarrhea when you take medication, because the medication can cause a runny tummy.
Classically, amoxicillin with clavulanic acid.
Yeah, one of the antibiotics that we would use. Yeah, could cause a runny tummy. And then obviously there's some more horrible things that we don't need to get into detail with. But if you are having persistent runny tummies, watery stools, and it's not getting better, we'd need to have a look and see if there was something else. Because normally, if you have a diarrhea for more than 14 days, which is a long time, we'd call that chronic diarrhea.
Yeah.
Acute diarrhea we expect to settle, as Mike said, in 7 days. And that gap in between we would call persistent diarrhea.
And with the persistent diarrhea, we expect you not to dehydrate. With the chronic diarrhea, we expect you not to dehydrate, but you will lose weight.
Yes.
Your acute diarrhea is where you can actually dehydrate quite quickly, especially if you have associated vomiting and you're not keeping up with what is going out.
Yeah, so you're going to get diarrhea either because you are eating something that is making more liquid in your intestine. Your bacteria are chowing the lactose, they're producing lots of gas, they're making lots of liquid, and that's what's happening. You are eating something that's making you get a runny tummy, number one. The second thing is if there's an infection, the infection has infected, made sores along the lining inside your intestine that instead of being able now to suck the fluid from the intestine into the body like it's supposed to do, the fluid actually just gets leaked out. And in fact, some of the bad infections, it doesn't just leak out, it actually pumps it out.
Yeah. Actively.
And then the more serious things are when you have an inflammation of your intestine or your colon, things like ulcerative colitis and Crohn's disease.
Inflammatory bowel
disease is the general term that we use, where the lining of your gut, called the mucosa, is not actually able to absorb or suck up the liquid from the intestine or colon, and it just kind of stays there and it leaks. So that's really where we are as to why you get diarrhea, what diarrhea is, and
I saw a child yesterday, and it feeds into this, literally, that the child was okay. He was having a bit of diarrhea, but the moment he has milk, he has a diarrheal stool afterwards. And that's because he's had diarrhea for a week. And the longer the diarrhea lasts, the less the body's able to digest the protein in the milk, like if it's a child drinking milk. And that's what we call an acquired lactose intolerance. So it's not something that's going to be there for long. But what's happening, just in terms of why there's diarrhea with milk, is that the sugar is not being broken down, and that sugar pulls water out of the intestine. That makes it more watery. And because you have all the sugar, like Simon, you said, the bacteria then acts on it and makes you gassy. So that's why you have this gassy, diarrhea, explosive infection.
Yep.
That requires management.
And then really what it's about then is just having a look at your child and saying, right, so we do have diarrhea. Why is the child's... Well, let's take a step back. Let's say my child's having watery stools. Is it or is it not diarrhea? So it's not diarrhea if it's a baby who's on breast milk, who's having them normally like we've spoken about. It is diarrhea if your child is sick with it as well, or if you can identify that the child has had something to eat that may have upset the tummy, or that it's been going on for a long time, or that there's mucus or blood in it, or that the child's got a high fever with it, or that it comes and goes and comes and goes, or the child's tummy is bloated, the child's not gaining weight, or the child's losing weight, a child's just generally unwell. Those are situations where you go, hang on a second.
Something's going on.
And if the child's vomiting badly with the watery stool, then you're dealing with diarrhea.
So an important thing to remember is that in the same way that when you have an infection or like a stomach bug, you do not have an appetite. Your child is not going to have an appetite, but you're invariably thirsty. So as long as they are thirsty, give them fluids, give them fluids, give them fluids. If they want something a bit more substantial, then that's fine. But how we are looking after them is giving them fluids. But we'll go into that into treatment.
Yeah, so I think this section really was just to try to give an overview of when we need to be concerned about diarrhea, and when it is diarrhea, what things would cause it, why it happens, what in fact is going on in the body. And then also when you've decided that the number of watery stools does equal diarrhea, what the other things are you just need to run through your mind. You know, in the previous podcast, we've spoken about fever plus, coughing plus. We can now talk about runny tummy plus.
Which we'll cover in the
Which we'll cover in the next one.
No, not next one.
Next one.
In the next one.
Okay, 3 from now, in the warning signs. Next we're going to speak a little bit more about why. So we'll talk a little bit more about the things that cause diarrhea, just to unpack it and to inform you.
If your children have allowed you to, thanks for listening.
Thank you. Thanks for listening. If you found this of value, please be sure to sign up to our email list at www.careforkids.co.za. and that's the numeral 4. And subscribe in your favorite podcast app or follow us on Facebook.
At Two Peas in a Podcast.
At Two Peas in a Podcast.
TWO, not the numerical 2.
This is our disclaimer. The information we have given you in this podcast is our own personal professional opinion. We're giving it to you for your own information. Please don't use it to treat yourself or to treat anybody else. Rather, go and see your own medical healthcare provider and follow their advice.